All right, ladies and gentlemen, let's call this to order for Tuesday, September 9th for the Health and Human Services Board. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman,
Here.
Marshall Savitsky,
Here.
Chuck Van Etten, Jeff Haney, Don Pettit,
Here.
Dr. Dunlap,
Here.
Carol Pearson. You have a quorum.
Excellent. Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America,
and to the republic
which stands one nation, under God, indivisible, with liberty and justice for all.
Do we have certification of the compliance for open meeting law?
This meeting was noticed to the media and the public as required by section 19.84 of the Wisconsin statutes.
Excellent. Do we have any public comment? Online? All right. Let's consider approval of the minutes from our previous meeting of August 12th.
I'll make that motion.
I'll second.
Motion's been made and seconded to approve the minutes. Any discussion? All in favor?
Aye.
Opposed? So carried. External entity reports. LCO, welcome back.
Miss Lorraine.
Right there, man. Okay. Yeah, I'm gonna be representing the tribe now back on the board. So I just wanted to let you know that I've been appointed and I'll be joining you. So I was active when I was in council before, so it's good to be back and I'm be re-engaged. So I will do what I can tonight, but I didn't get everything I needed for tonight, but I'm gonna keep moving forward, okay? And I was reading some of the last minutes of the meeting, so I'm trying to update on where the issues are with the county too. But I do have a couple things I wanted to mention, and I did get a chance to talk to a couple people, so I just wanted to let you know that like with our Elder Center now, it's up and running, it's been operating. Tweed knows this and shared that. So the programming continues. And one of the things she did mention to me is we would like to have more respite care for our elders. And so we're looking for ways on how we can keep increasing that area so that they can remain home, but yet have more people helping to care for them. And then those who are caregivers to have that time where they need to have that break or, so they have that support too. So she asked me if I could bring that out, the awareness out here, and if there's ways that we can work together on that, that would be good. And with ICW, I wanted to mention that the tribe and the county work closely together on things. We do. The 161 agreement hasn't been renewed for a couple of years, so I know that's in the works. And we'd like to get that renewed and updated and continue those joint efforts to provide care for the children and families. And so hopefully we can get that taken care of. And
Are you guys ready for it to come to
I
tribal
think
government board?
it's been worked on, and now we just got to do the final pieces to bring it together.
Okay.
And when that happens, it'd be good to have our ICW director and the county director at that time together, so everybody's on the same sheet and working together collaboratively, so.
Yep, and I'm the one that's working with Tabis.
Okay, good, good. Then the other thing, I know the clinic is up and running now. It's a beautiful facility. We're offering all the healthcare that we can for our people. And we have it all located in one building now. Viziki and the health providers are all together in one building. And so as we continue to grow and provide the care that we need, we do have 2 nurse practitioners that will be joining us soon. And that'll help because as you know, sometimes when office departments change, that we need people to fill in positions and we need people there to provide that care. So we are looking, I think, for another medical doctor. But in the meantime, we've got 2 nurse practitioners joining us. And then the Bijiki Center is building on the cultural teachings and ways to help our people heal and having more community healing events and having things provided for our community in different areas so that we can provide that care when our people need that. And just to help heal. And the university opened its dorms now. We got the dorms open. We just had the opening ceremony the other day. And the university is going to house up to 80 students, and that'll help those who are continuing their education. And, we're taking baby steps now, we're growing, but that's for all students, not just native students. It's for all of our students who need that care there. So that I just want to remind people that it's for our community. So, but I think that pretty much covers it for now. I'm like I said, I'm catching up on things, so it's a lot of stuff's been happening. So I just gotta get reconnected now. So, thank you.
Do we have anything from the Senior Resource Center? I had an interesting telephone conversation with someone that rides the bus, the senior bus, and she's having trouble being able to carry all of her food share on the bus because they only limit it to 3 bags. Yes. No. Okay, well, I got an earful. Administration. Is that you, Mike?
I don't know, I was wondering if Mike was, are you looking at some notes to say anything? Okay, what I have is I've got two employees that will be leaving. We have Kathy Garby, who has been with us since July 27th, 1987.
Oh,
She's been working in clerical over the years. She's done a number of things, but mostly spent a good bulk of her time with Child Protective Services and Youth Justice. And she's really been the glue that's held that department together through all the different transitions that have happened, especially in the last couple of years when we kind of lost all our staff and had to rebuild. So we're so thankful that she has stayed on until we kind of gotten ourselves whole again. And she will be retiring October 3rd. So that's 38 years of service to the county. Not many of us can say we worked in one place for that long a time. So we very much appreciate it.
will we be giving her a gift?
We will be having I believe on the 2nd, we'll be having kind of a little social during a lunch hour. And yes, we'll be doing a plaque for her for
Okay.
her retirement. And that will be those pieces. She kind of likes to not be too much out in that limelight. She stays in her office and gets things done for everybody. But we told her we had to celebrate her over her years. So, and then Joyce Knowlton has also decided to retire. Technically, this is her second retirement. She's been retired from Minnesota law enforcement. And she started with us in November 2020 as a contact tracer. So she came on with us per diem and through COVID. And as we phased out of the need for contact tracing, she stayed on to help support us in a number of areas, including putting together our public health website. She's done opioid data collection, fentanyl awareness. I think the biggest thing that she's leaving us with at this point is she's revamped all of our emergency plans. Everything's in place. We have a trailer, we have cots, we have everything ready to go. She's got everything just set for that next person to be able to pick things up. She's also reinvigorated our Medical Reserve Corps. So what we want to make sure we do is we do not lose that the volunteerism that we're getting with that, because that's really going to be helpful should we have an event we need to respond to. So her last day will be September 30th. So those are our two changes that we'll have. We have a couple new staff that are coming on, but I will do that at the next meeting to kind of give you a little bit of information about them. So that is the administrative update.
Okay, let's move on to Aging and Disability Resource Center.
Hi, Carol Martin from the Aging and Disability Resource Center and Adult Protective Services. Good to see you guys again. We've been busy, lots of more complicated cases that are coming in for adult protective services and such. Our new adult protective services, Rebecca Erickson, she and I have both been jumped into the trainings for the UW Green Bay for the formal APS trainings. There's also going to be a Ho-Chunk. It's a kind of panel and gathering for strengthening APS partnerships. So we both plan to go to that, even though we work with the tribe so closely and we're constantly helping staff situations together and such. My new elder benefits specialist, we are invited to the LCO's 2025 Health Benefits Fair on September 19th. So she's going to be on the panel for that to talk about Medicare, Medicaid, senior care, stuff like that. And so we're looking forward to that too, and we'll have a booth there as well. Then also our dementia care specialist, we've got powerful tools for caregivers starting in October, which we are presenting this time. And she's doing it in collaboration with the LCO dementia care specialist, so that's pretty cool. The 19th annual caregiver conference is going to be happening on Friday, September 26th. It's a watch party again that she's organizing. And then she and Angela, the dementia care specialist at LCO, they are doing a radio show currently on WRLS on Lifestyles North. The next one is on 9/24 at 8:30 in the morning. So if you guys get a chance, they've decided to name it Dementia Detectives, Clues to Live Well. And so if you get a chance, I hope you'll listen to it and give her some feedback. She is very, very, very interested in presenting to you guys about dementia friendly. And she's very, very passionate about dementia. She also just gave us some information on our summer residents, the increase that we have at certain times of the year with our resident booming. And that's what we've kind of seen this summer, is that all of our cases are booming. And a lot of that is to do with those rooming houses and such. So she got some information of that. We got it to Julia, so hopefully she and Julia will be able to coordinate and look at that next time or the time after. And then she would really, really, really like to do a dementia-friendly training with the ADRC members of the board. So I'll give her your names and numbers if that's okay. And so be prepared. She's very passionate. Thank you. Any questions?
I think she's doing a presentation at the library for the.
Yes.
Yep.
Yeah, and she's, they also connected with her to do a dementia-friendly business training there. And so they're going to be up and running again with their dementia-friendly staff. So, which will be a good thing. Yeah.
Can I ask a question?
Mhm.
I forgot to mention this before. One of the elders asked if there was, how quickly you can get that life alert when we have our elders who may fall or have fallen.
We actually
Take
don't
care.
do Life Alert. They do have a project through the Senior Resource Center to provide people for that. And so that's the 634-3000 number that they can contact. And then they do have Project Lifesaver through the Sheriff's Department.
Okay,
Yeah, if that's helpful.
thank you.
Yeah. And at the Senior Center, you can talk to Joe D or Joe E. Either one. Cool. Thank you.
Thank you. Do we have a behavioral health report?
It should be attached.
Yes, okay. I couldn't see you, Alicia. I wasn't sure if you were on.
Oh, yes.
So do you want to, are there a couple things you want to highlight?
Yeah, one thing we didn't mention, we have a person that is leaving us in our CLTS program, Terry Brown. She is resigning, and her last day will be November 21st.
Oh.
So, we're going to have to try to juggle that caseload of hers in between Ruth Ann Gilmore, who's full-time in CLTS, and then Haley Sands, but Haley also works as our OWI assessor and trying to get CCS up and running. We just don't have the staff that we need to do all of these things. So hopefully we can get some job postings out there and have some applicants. Since I wrote this report, as long as we're talking about CLTS, we've had another 3 referrals. That's the biggest program that we've got. There's a few kids that are three suspensions right now just due to being in passages for assessments, and one for not being able to complete the functional screen. But we've had 6 referrals. And when school starts, we always see an increase in referrals to this program. So we will definitely be over the 60 mark, probably more like 63, 64 within the next couple of weeks. So it's a little anxiety provoking with Terry leaving us, just to be able to manage all of those clients with 2 people. CST is going well. We're working collaboratively with Youth Justice on their diversionary program. We've had 1 referral from YJ so far. We're following up with Sarah on that, and I always forget her name. Melinda. Yes, sorry about that. So that's going well. We have certain goals we have to meet for our grant, but they will be met by working with the diversionary program. Allison Carlson, she is the CST coordinator. She's got 6 kids right now and has had 1 referral outside of YJ. We're having our next system of care meeting tomorrow. That's at 2 p.m. She sent out a link to everybody, and it's also in the assembly room. We're updating the assistance guide. Hopefully we'll have that done by the end of the month. Let's see. CCS, we had a meeting this morning with Julia, Carrie, and Haley, myself, discussing some potential options. We have not had anybody apply for the position that is on our website for the mental health clinician. Kind of gone over that with Julia, but maybe making that LTE position just to get somebody in, even if it was a couple days a week, because we are not getting any applications. Our intoxicated driver program continues to grow. So far, we have done 38 assessments this year. We always see a spike during certain holidays. That's common. We're looking at, there's going to be another training for the IDP program that should be sometime this fall, just to kind of update the assessors, and there may be some more additions or deletions in Chapter 75 that we have to adhere to regarding the intoxicated driver program. That language has not come out yet, so we continue to attend the roundtable discussions just to make sure that we are following all of these changes and all of these programs. It seems like weekly something is changing. And that's about it. Anybody have any questions?
I do. Alicia and Julia, does this behavioral health program have any impact on our out-of-county placements? I mean, nothing?
No.
Because I remember when Joe Boda was here, he talked about, intervening and interventions coming in before they got to that place where we
Right.
had to transfer them out of county.
When we talk about the community support program, Caitlin will be on to talk through that. That one really makes the difference. It's typically those clients that are getting an out of home, that they have that really high mental health need where we might be monitoring their medications every week, trying to make sure that they take their medications. That's the program that really can be impactful
Okay.
with those out-of-home placements.
Thank you, because I know, right, Mark, that's hitting our
Yeah.
budget pretty hard, and it's hard to.
Yeah, it is. It's hard. Okay. Anything else for Alicia? We can move on to the community support program and mobile crisis. Caitlin, I know that you've jumped on. Did you want to go over maybe some key things that you've got going on right now?
Yeah, I think July kind of steadily continued the way we've been seeing. I know when we get to report on August, there will be quite a change in at least the crisis numbers, but the community support program has about the same clients. We're just under 50. Happy to report that starting October 1st, we will have a nurse practitioner in addition to our psychiatrist to help with this population. Because as our CSP population has aged, we've had some new clients added to our program that are definitely needing some more of that intensive support from a prescriber. So we will be anticipating that change. And then in the mobile crisis realm, yeah, numbers are about the same. I know we've had to collaborate quite a bit with Adult Protective Services and like Youth Justice on a few folks that we met in July. And so that's been really, really helpful. So thank you guys in those departments for helping out.
Okay. Any questions for Caitlin? August has definitely been busier. It's been, I don't know how much sleep she's gotten. I see that our mental health expense report didn't attach, and I thought it was on there. There isn't anything too outstanding. That was just moving right along as we have been. What I can do is move into talking about the what do we call that one? Cost by clients. We will be seeing some changes coming up here. One of our clients ended up going to Winnebago, and then we ended up moving that client to a crisis bed, and now we're bringing that client into transition, so that will reduce costs over time. So that ended up being a move that is making good progress. We have another client that has escalated. She's been escalating for the last 3 months as a client that's out of county. So it's hard to manage some of those escalations when they happen. We're working on a crisis plan for that. The positive thing is when she does go to Winnebago, her payments stop at her other residence, so there is a hold there. And we will be trying to work on what does that plan look like. This is a very, very complex client, probably one of the more difficult ones in the state to manage. So we're reaching out and talking to a number of people on what we can do to put in place to kind of hopefully try to get back to a baseline. The client was doing quite well for probably well over a year. All restrictive measures were reduced, everything was going good. Then some things had escalated in their life and have gotten us to this point. So we've been very busy over the last couple of months trying to rearrange things with some of these clients. So still working closely with Joe on helping with some of these commitments, making recommendations, kind of pulling those pieces together with Duffy's office. There's just no way that I could be like right there managing some of those pieces and trying to direct programs. So that's what we have going on there.
Julia, I had a question. So I was looking at that and looking at the client account balance and the ability to pay, some of those are covered by Medicaid. Is there a way that we could see what the payment is so that we know that they don't have that total account balance? Or is the
No.
account balance after Medicaid?
I believe it's after. I can validate that.
Okay.
Because Medicaid would only come into play if they're like end up getting hospitalized or in other places that would be covered. But once they're in a long-term placement, like a supportive home care placement, that Medicaid doesn't cover those
It does not
costs.
cover that?
No. No.
Wow.
And if they're not, so this is where we kind of work really closely with Carol's team. If there is some way to get them functionally eligible into some of their programming, then like an Inclusa would pick them up for long-term care. But mental health is not something that is covered as a diagnosis. So even if you have severe mental health that keeps you from being able to function normally, that is not a covered thing that we can get functionally brought in.
But to be long-term care functional, you have to be in a target group of elder, physically disabled, or developmentally disabled, or some similarity there. And so if the need doesn't relate to one of those three diagnoses, you can't calculate it, use it as a calculation.
So, yeah, I know, that's why we are bumping our heads up. Sometimes they do shift, we watch them as they get older. Some of them will eventually shift into that need, and that's what we'll be watching for. And or hopefully get to a point where maybe there is somebody that can help take them on, like they're not too level, and, is there another way that we can try to serve this population?
Thank you.
I got a question. Julie, is there any health insurance that we could purchase or they could purchase that would cover long-term care?
I don't know if you can do that. I've never heard of that. That's a question that I've never heard of or had anybody talk about.
Yeah,
You haven't heard anything either. I'm just looking back at them. Yeah, and then it has to be prior to.
But it is dependent strongly on the policy that you purchase.
right. Because I know paying the premium would be a lot cheaper than paying the price of
Mm-hmm,
institutionalized.
mm-hmm.
And I know Lorraine knows a little bit about that, what the tribe has done in the past. Okay,
Purchase insurance or no, just had to pay for things.
When you had to pay for things.
Yeah,
We assisted and then paid the premium, which was much cheaper than
Yeah.
paying the cost.
I don't know. I've never heard anybody go to that strategy, so.
Could help.
Yep. It's worth writing down and taking a, taking a question on it.
Okay.
Where are we at?
Youth and Family Services.
We are, with Kathy leaving, we're in a transition on where we're going to be on our Child Protective Services report and out-of-home care report. So we're in the process of transitioning that. We just met with Indian Child Welfare on cases. It seems like we're doing pretty good at keeping caught up and kind of monitoring through some things. We do have a couple of kiddos that we are concerned about placements on. So we'll be kind of looking through some of those pieces. Moving into do you mind if I move into the YJ report? Moving into the YJ report, July ended up getting a little bit busier on referrals, up to 11 referrals, 19 for the year. So you can tell July was a busy month. We have 28 open cases, and we have made the hire of Jamie Eggertson, ooh, I have trouble saying that, on August 25th. So she's training in now so that Sarah will be able to move some cases over to Jamie, and that will free up her time. And then the report for the children in substitute care is in here as well. And in this report, Kathy really does by hand. And so I'm guessing it's going to look a little bit different in the future because I don't think we'll be able to replace it identical to it is. But we will come up with one that makes some sense and adds and does the data for us.
It looks like there's some new additions to that report, like there are 2 of them that they've been in there one day, 7.
Oh, new kids. Sorry, I thought you
kids.
just meant new.
No, no, no.
Oh, yeah. Yes, yes. We could easily have some new, there are continually, if we need to take kids out of home, they automatically go into this report. And then we just hope that we get to return them back once we put something into place. So we'll actually, just as I'm looking, we're gonna have to get Lorraine's email so that she gets on this. Okay, okay. So that you have the packet, Lorraine, before the meeting.
Okay, thank you.
Okay,
Economic support report.
and I don't think Shauna's on. We have been meeting, we just had a director's meeting with income maintenance and just looking at what we need to be thinking about for 2026. It looks like if we have the impacts, it'll be a little bit towards the end of the year because it's the federal fiscal year that we kind of would start to see things come into play with some of the extra pieces that we have to do administratively to ensure that people are following the new rules for W-2, or not for W-2, for Badger Care, food share, and those types of things. So we're just still watching. We really don't know exactly what all is going to be required. That's still kind of coming forward. So I think the biggest concern is that the SNAP program, making sure our error rate stays low so that as a state, we're not needing to pay in more than, we want to be that error rate that's, I think, below 5.5%. Otherwise, those that have higher error rates are needing to pay more as a state. That trickles down to counties. Otherwise, our data is looking awesome. And one of the things that we did talk about, not something that we always like to say and do as a service, but we might, as things get busier, we're going to need things, our call times are going to be lower, or the calls answered rate is probably going to be lower. The time that you're on waiting on hold is going to probably be a little bit longer. Those things are just going to have to give because we can't really hire more people. We're going to have to try to make do with where we're at. So just wanted to set you up for that, just in case we start to see some of that shift now. That is it for economic support.
Let's move on to public health.
And I think Julie has some things. Are you going to talk off of this, or do you want me to pull up your slide?
I'll start this and then I'll switch to the.
Okay.
My name is Julie McCullum and I am health officer. Just a couple of additions to my written report that was submitted. I did include the MRC. If you scroll,
She's got it.
Thank you. If you keep scrolling, the MRC newsletter is there, and Julia already mentioned that Joyce, who's been our coordinator, is retiring. But I did want to just mention, Joyce did do a little blurb there, and wanted you to be aware. The second thing is I did include our poster for our legislative breakfast. This was part of our local prevention coalition. We collected data, did an assessment in our plan, and then submitted it to the legislatures at that breakfast. So wanted to include that. If you can go to the slides.
Okay, now it's my turn.
That would be great. Just earlier this afternoon, Wisconsin put out that we're up to 25 cases of measles. There are 1,431 in the U.S. This is the highest number we have seen in on an annual basis since 1993. So it is rather notable and significant. Clean sweep, oh, yeah, that's, did I lose my slides?
I lost the PowerPoint.
Oh, that's okay, I'll keep talking.
Talking.
I'll keep talking. Clean Sweep is next week, Tuesday, at the Sawyer County Fairgrounds. It will run from 2 to 6, so next Tuesday. And I think you could scroll. There's the measles, just the update, Clean Sweep event. Really, this is one of our initiatives for harm reduction to get, we do collect sharps and we do collect unwanted medications as well as unwanted electronics and household hazardous waste. So it will be one collection point, but three events at that one time and location. Walk for Tomorrow is the next slide there. That will be in both Winter and Hayward, mental health awareness and suicide prevention. We're partnering with Winter and Hayward School for that. And community stakeholder meeting. On October 30th, we plan to have our second annual stakeholder meeting to discuss community health initiatives as a part of our community health needs assessment and our community health improvement plan. So I did send this out via email, but wanted to make you aware to save the date for that. Any questions?
When did you say that community health awareness initiative?
Oh, the last one, the community stakeholder meeting? Yeah, the community stakeholder meeting will be at LCO University on October 30 in the morning. And that's going to be a discussion, and we really want broad representation from Sawyer County, agencies, organizations, businesses. We're sending out to elected officials, community members with a vested interest in community health matters. And that time will be sharing where last year when we gathered in October, it was in response and getting community health assessment data. But now we have our plan, and it will be sharing that as well as looking at gap analysis and doing further work on our community health improvement plan as a group. So
When you touched, I hate to keep going here, but when you touched on the vaccination, that rate of measles and the awareness that we have to have for our community and how we need to keep that health protection in place, and what's happening with the government right now, it's not good. There's
No.
people at risk when there's things happening, and we're going to see more and more. And I just think we need to keep working closely together on how we can protect our people.
absolutely, absolutely. If you'll notice, and it's very small print, you probably can't notice it. But I'll let you know, we've had 25 cases in Wisconsin, all are unvaccinated. So of our 25 cases that are all confirmed, we don't have any probable cases at this time. We have 25 confirmed cases and all were not vaccinated. We do know that with one vaccine is 93% effective against measles. And if you get two, which is recommended, it's 97% effective. So we know vaccination is our best defense at preventing transmission. For sure. And really, it's notable too, and maybe you can share on that far right-hand column. I don't know who's.
Oh, I'm sorry.
No, you're fine. You can see the ages and distributions, but we have a large percentage are in unvaccinated members when you look at the whole United States. So, not that. It's like 1 MMR. 4%, 2 MMR doses, 4%. We do have some breakthrough, but most are unvaccinated, 92%. No, but good comments.
It looks different on this.
Are there any barriers to people why they're not getting vaccinated? I mean, is it cost? Is it access? What is it? Because I used to give a lot of those shots in the clinic too, but.
We're seeing some vaccine hesitancy. not wanting to be vaccinated for various reasons. Families choosing not to vaccinate. In some cases, they are willing to vaccinate if they know that it is a threat in their state or in their region. So I think Dr. Dunlap at our last meeting had mentioned that she has a list of families who chose not to vaccinate now, but if it is a threat, like if we have it in our state, that they would come in and get it. So it might be multifactorial, but there are people who choose not to. I'm not saying that there aren't other barriers. We do have vaccine for children, which does cover those who are uninsured or underinsured. Those with Medicaid, Native American would be covered under that Vaccine for Children program, which they could come into our clinic and receive the vaccines that are covered under that program at no cost if you qualify with those criteria. Many health insurances do cover, so providers can give vaccines as a part of their well child. We did see well child visits go down during COVID, for sure. There was a definite decrease in in-person visits there, and you'll kind of see vaccination rates go down with that. So that was a potential factor as well. So a number of factors.
Serious side effects with the MMR injection or vaccination?
It is a live attenuated vaccine. So there can be mild side effects, typically like a reddened arm, you might get a slight fever. Generally speaking, though, children handle it very well overall. But absolutely, there would be mild vaccine effects.
Do we have any measles cases in our region?
At this time,
In the region?
in our region, in the northern region, no, not currently. The 25 cases are actually kind of in the northeastern part of Wisconsin. So, yeah. Thank you. Yeah. Oh, Matt, do you want me to?
Matt's gonna jump.
So we do have another part of public health. Matt McKay is going to give an update on TRHs and kind of where we're standing with that.
Good evening, Matt McKay, Sawyer County Health and Human Services. Work in environmental health and kind of oversee licensing of tourist rooming houses for Sawyer County. Excuse me. So just want to give you a little update on where we're at. So I gave an update a few months ago, and that was kind of at the time we were entering into our busiest time of the year, which is the renewal season. That's when we have 960 facilities that we issue license to throughout the county, and then they all need to, if they want to stay in business, tell us that they want to renew their license, and so they send in applications and fees, and so it's a very busy time for us. And there was a fear with the introduction of the new ordinances that were placed on tourist rooming houses that we would see a significant decrease in a number of lodging facilities available for, say, tourists in our county. So I just want to kind of throw out a few numbers that around January 1st of 2025, when we had been hovering right around 600 for about a year prior to the renewal season. And then we finished up our renewal season as of August 15th. The season goes from April 1st to essentially June 30th. And then from July 1st to August 15th, they can still renew a license, but it's considered late. And then there's additional fees. As of August 15th, if we don't hear from them and don't receive any information or no fees, no application, and then we put them out of business and we send them a cease and desist letter. We did have to send out a few cease and desist letters. Some of those just chose not to inform us and chose to be out of business. There's a few that wanted to be in business, and so we have to kind of start all over with those. But so yeah, we are now for tourist rooming houses, we're currently at about 550 licenses. So yeah, there is a decrease there. But what I want to note is that we did, lose 130 licenses, but of those 130, some of those licenses were consolidated down into what were maybe somebody had 3 different licenses for 3 different rental units. They were then lumped into one county license, one state license. Our goal was to try and license each individual cabin or facility for that owner. But due to some changes that are coming up with the state, the Department of Ag, Trade and Consumer Protection, and then not having necessarily like a program or software to be able to really track this information, it was pretty much impossible for us to kind of do that and also still kind of flow with what the state is doing as well. And so then since the licensing season, we also gained about 74 new facilities. Some of those are rearranging some of the current or existing licensees. And then this year, we've seen since maybe spring up until now, we've seen a significant number of applicants for new tourist rooming houses in the area. And so yes, our overall license number is down, but really we're hovering maybe just slightly lower than where we were, say, at January 1st. We're now working on 7 licenses as we speak to get them licensed. And then during this time with renewal period, we hadn't paid as much attention to our looking at our database to see which facilities are operating without a license. So we're getting caught up with that right now. So we sent out about 15 letters today, and we'll be getting more. So we got another 25 that will be coming on board here shortly. So we're getting back up to that 600 mark. Yes, overall, we did lose some facilities because of these new ordinances, but again, it wasn't maybe as significant as some may have thought was going to take place. So next slide. So during this process with the new ordinances, we knew that we were going to get some feedback from our stakeholders, and I think it was no surprise that some of those things were going to be, having the requirement for an owner's agent if they lived with outside of 60 miles of that facility. So then they had to have that owner's agent. Some confusion there, but we got them on the right page. Another requirement was letters to the neighbors. Basically, any facility had to send a letter to their neighbors within 300 feet of the property boundary. There was some questions on that. Some just thought just the immediate neighbor was good enough, and so we had to kind of show them that they needed probably to go further than that. I kind of thought max occupancy based on septic size was going to be our biggest impact or biggest hangup. But after working with individuals and educating them why this was done, the ordinance was done the way it was, a lot of them thought that made a lot of sense, actually. Not everybody wants to maximize how many guests they can have in that facility. They just want to have a few and not have to worry about significant damages and stuff like that, or just wear and tear on their facility. So we actually had people yell at us or be mad at us because we put a higher number for their max occupancy based on septic system, and they didn't want that many, so they wanted to change it on their license. So we were able to do that as well. But I would say our biggest hang up was the sign that was required out in front of the properties, identifying like who are the local contacts for that facility, the address, license information. So we received a lot of phone calls, emails, strongly worded letters about this, as well as now that this is in place and we're out doing inspections, we've had implications with enforcement is also difficult because when we are out there doing inspections, that means they're not renting it. If you look at the language, it says when the facility is being rented, right? And so when we're there, that's not being rented. This time of year, things start to slow down. It's the busy season is not there. And then they're not posting it because they might not be renting it for a while. So when we go out, it's hard for us to know whether they're actually truly posting it or not. Yeah, I guess the next slide then. So we thought now that we got through the first year, through creating the ordinances, getting it passed, getting it implemented, getting everything licensed, thought we were in the clear, right? But at the same time we started our ordinances and the work implementing that, having our meetings, the state also kind of started rewriting or the process of rewriting ATP 72, which is the lodging code for hotels, motels, tourist rooming houses. Next. So what does this mean? No, we're not done yet. Proposed ATP 72 code changes would possibly affect resorts with rentable cabins as they may be considered TRHs going forward. And this may be required to comply with current TRH and county ordinances. So right now, what we've done is, for example, these are some of the simpler tourist rooming houses on a single cabin on a single parcel of land. That's what we've been working on as of this last year. Next. We've also been working on the smaller resorts that have 1 to 4 units. Those we've been are required to have and follow the new ordinances. Next slide. Same as well as having an individual that has 1 to 4 parcels adjacent to each other if he or she owns all 4 of those. Well, in this case, there's 3, but they could put a 4th one in the middle there. That's where we thought we could try and do a county license for each individual cabin for that person. But again, because of what I mentioned earlier, it got kind of complicated. So this individual is receiving 1 state license and 1 county license. But where the changes come into play with the rewrite of 72 is with the larger resorts. So it could be a resort where you have a single owner that manages all the cabins, or you could have another resort where each of the cabins are condoed off and individually owned, but that there might be a lodge or main resort. They might have a manager that oversees all those cabins and manages all those cabins. So in both situations, they're going to receive 1 state license, and then should the wording go through as it is, they would get 1 county license as well, but there's going to be different classifications. I'll show you those classifications in just a moment. And then the code is also going to possibly introduce another category of lodging facilities that we haven't really seen before. Lodging also includes hotels and motels, but specialty lodging is basically going to be other types of, say, cabins or yurts or eco structures that are eco-friendly, where basically they don't have fixed plumbing for potable water like a well or plumbing for septic. Currently, that's what's required in order to have a TRH. These are going to be those other types, and so we'll kind of have to keep an eye on this and see where this goes. And
Matt, I think zoning is looking at with their campground ordinance, that exactly thing. Whether they can put.
It says greater than 400 square feet. The camping cabins are 400.
camping cabins would be under 400, but so these would be, outside of a campground, but yeah, it would meet those square footage requirements. I think there was one more. Yep, and so here's the breakdown of the different categories that is being proposed by DATCP. Right now, as the code is right now, we have 1 TRH category, and that's 1 to 4 units. Anything above 4 units or 5, the next category would be 5 to 30. That's just a lodging facility, and they get a lodging license. How it's going to get broken down going forward, should this language go through, any, say, larger resort that has more than 4, they would be put into these categories. So they could have just a single cabin, which is what we talked about earlier. They could have 2 to 4, 5 to 9. And so they have different fees based on the number of facilities that they have. The fees kind of are there because of the amount of time that they change because of the amount of time that we are in there doing inspections. And the state has not updated their fees for, I'm gonna say like 15 years or something like that. It's been a significant amount of time. So now they're looking to increase those fees to come more in line with what is really needed to support the program. So we don't have to necessarily match that per se for, say, like the first TRH at 296. But we're going to want to look at our budget to say, what do we need to be, where do we need to be at to be budget neutral for our program? So our program can't make money, but we obviously want to not lose money. And so we have the authority to, we could be slightly under that, we could be slightly more than that or at that, but we have to be able to justify it. And so that's something that Julie and Julia will be looking at to see where we need to be for a fee structure for ourselves then. So then where are we at with the lodging code for ATCP 72? We're in the last two phases. We anticipate that it's with the joint committee right now for review down at the state. We hope by December that they will approve that with not any major changes. And then if they approve that, hopefully within early January, February, then they would make the rule. And then from 90 days after the rule is established, then that's when it would go in effect. So there could be a very tight window for us come springtime. If this rule goes through, we have to then go through all our facilities and update, how many, to break them down into those different categories. And so it's not going to give us a lot of time there, but we'll see what happens and how it all rolls out. But and then I guess just to wrap up then, because of a lot of work that's been done with our ordinances and trying to get that all taken care of, there's going to be, obviously, if this goes through, we're going to have more similar work with these larger, say, resorts or larger facilities that we now consider tourist rooming houses. So we have to look forward to doing some of that same work again. But then we're also trying to get caught up on some of the other work that kind of maybe got pushed to the side while we were doing that. And so there's no shortage. But any questions about anything?
I do.
Yep.
I go. Didn't we hire an entity or something to manage, or wasn't there something that we had paid for? And secondly, how did we come out then when you mentioned budget neutral? Did we lose money, or did we break even, or did we make money?
As far as the first question goes, did we hire, did you say? Nope, sorry.
There was some kind of entity that we were doing something that we decided that we would have these people do something, and then I don't know.
It's the website thing.
So it's called Granicus. And yes, we hired them to help us track. So when I said we were looking at about 18 places that are operating without a license, we are using their platform to search for those facilities that we know don't have a license. So that's one reason why we use them. And then we also are using their 24/7 emergency hotline as well for any complaints that are coming through. And that's been working out pretty good. We still got a little more work to do with Granicus to update our information now that our licensing season, renewal season has ended. We got data that we got to get to them. But here in about a month or two, we will be in a better place. But yes, we have been using that service, and people have been calling in on that, and we've been going out to address those complaints.
And fiscally we'll be fine. It's just kind of looking into the next year when they change how these units are set up and what does this look like and how does that impact. That we'll have to look at that fee structure, because the state bases the amount we have to pay them. We pay them 12%, I think, going into this next year of what we get on our fees. And so they base it off of their fee structure to start off with. So we just need to make sure that we're staying up with that. So, and we'll kind of talk through it. Unfortunately, the fee structure is not going to come in line when the budget comes in. It'll come in line when this gets approved. So you'll see me coming back with a new fee structure.
So Matt, I know when the license was being talked about, the owners were really afraid of the complaint aspect of the license. Did that come to fruition where people were in jeopardy of losing their license because of a number of complaints or not?
Yeah, there was definitely that concern that was out there. I mean, we have a couple facilities in the county that we're working with because of calls that we keep getting from the same location. And so we have a staff person that looks into those very closely. What we're finding out, there's always two sides to every story, right? And so sometimes people are always looking very hard for a reason to call that hotline, and sometimes they're warranted and sometimes they're not. And that's where we have to kind of be careful too, to look into these, find out what the true story is, and then, do we deem that as a strike against that facility? We're working with those, both, say, neighbors and managers of those facilities or owners of those facilities. And again, we want to educate them and work with them. Our goal is not to try and yank licenses, but again, we're documenting this stuff. We're using that hotline information. It gets documented on there as well. So no, we haven't had to close any facilities because of that. We haven't actually issued any strikes yet. But again, there's always just two sides to every story, and that's where we got to be very certain of what we're doing before we go and make a strike against a facility or you yank a license. So.
Matt, who's helping you or Julia rewrite these codes for the lodging codes? Is there someone in the state or is there?
It's the state that's rewriting that.
Oh.
Yep. We did our ordinances, but the state is rewriting that. It's basically what we use, state language we use as agents of the state to, do our inspections.
Are we going to have to rewrite our ordinance then and make an amendment?
That there is a possibility. So once we know what that final language is, we'll want to take that and review it and see if we got to make some modifications. I wouldn't think there'd be anything real significant, but there might be like definitions possibly, that kind of stuff. So yeah, there's definitely, when it's finalized, we'll want to look at our ordinances to make sure. And I guess we say in the ordinances or as they're amended by the state, I would, I guess, advocate to make those changes once we know what that final language is, instead of waiting a year or two beyond. Let's just, since this is all fairly fresh, let's just do them as quick as possible.
Mm-hmm. So we'll be looking when that comes out.
Thank you.
We're at budget performance report.
We're at the fiscal piece here. And I think the areas that stand out, again, we've been talking about this, is these out-of-home expenses and hospitalizations. One of the, I'm just going to kind of talk in general. And by the way, next month, and this didn't make it in time, but we have revamped the purchase service recap and the revenue. And I think it'll be easier for you guys to be able to look at and read. So we'll have that for you next time around. One of the things I just wanted to kind of highlight, some of the things that we're looking at to potentially lower costs as we move forward. One of the things that I've just received some information on is, as we are looking at, and I have not done the homework to see how many clients this could potentially impact, but we have a number of kids who are in like a RCC, so a residential care or a group home. If they qualify for children with long-term care support, CLTS, they cannot be, they're no longer on that program. So once we put them into residential care, that disqualifies them for CLTS. However, one of the things that a toolkit that's been produced is a toolkit where if they're continue to be in foster care, they can receive CLTS supports. So there is an avenue that we can potentially look at, which is trying to develop a specialty foster care placement that would meet the needs of some of these children that have such significant needs that they can't be in a normal foster care setting. We're needing to put them into residential care, group home settings. If we can develop that, then we pay for foster care payments, which are fairly reasonable when you can compare that to a residential care facility. And then CLTS would pick up that balance on that more high-end piece of it. So just introduced in this last month, I have met with Amy, Amy Thompson, who does our foster care kinship program. She's really excited to jump in and start looking at that. We actually have one child who she was already looking at developing a specialty foster care for. And so this will probably be something that we will be able to trial and see how that works. So if we can move some of those, when I look at some of these kids that are in these treatment centers, they have such significant things that have happened to them that has made them it had made it difficult for them to function in just mainstream environments. But being in a residential care facility, I was talking with Tabissum, the director of ICW, it's not really a good place for a child to grow up either in a residential care or in a residential care setting, kind of institutional setting versus a home setting. So my goal will be to really be looking at doing something like that. And maybe we'll be able to take what we're learning from these toolkits, and is there a way that we can develop something locally for some of our high-end adults and that we can't get into, like Inclusa and other programs. So I just wanted to bring that forward, that I'm interested in checking that out.
So then would the foster parents go through a special training program?
Yeah.
And so that they
That would
were
meet those specific needs. And somebody who is already trained may decide to be able to come into doing that type of programming too. So, yeah.
Are those providers all in the county, or is that throughout the state, or?
This intensive foster care, it would be something, so we don't have any in our county. There are a few intensive foster cares throughout the state that I think we might have one in right now. Again, that doesn't, it gets them in a different classification, but if we can bring it in and do that administrative ourselves and keep the kids closer to home, that's what we want to do. So we develop it within the county, if at all possible, or at least close boundaries. So it's easy access for keeping close to those kids and getting those face-to-faces.
This is Dawn Pettit. I have a question for Matt about the Airbnb boarding houses.
Oh, well, he stepped out, but Julie or I might be able to answer. We can try.
I'm on the county website as we're in this meeting. Where are the ordinances for these the boarding houses? What are they under?
So, okay, sorry, you're not going to be heard. So Sawyer County Muni Code, and it is chapter 14.
What is it? Sawyer County what?
The Muni Code. So it's right
Okay.
within, it's right within all of the ordinances for Sawyer County.
Okay. All right. Thanks, Julia.
Yep. Okay.
We need to review the purchase service or.
Nope, that one
Because You're going to change that.
Yep, got a brand new one for you next time around, so.
Okay, good. So do we have any committee updates from anyone?
I can't bring up. I can bring up something for the Senior Research Center. I thought I lost that update from the director when that email merge or whatever IT did for us all, but she did send Jeff and I something over, and it's for this past month's update. It says meal prioritization in January 2026. It's called Right Meal and Service for You. It's going to be decided in the 2026 budget. The number of Meals on Wheels budget can provide to seniors. So the process after budget is decided on how many meals we can accommodate. All Meals on Wheels participants will go through an assessment and will be placed in one of 3 levels based on the assessment. Red is high need, yellow moderate, green is low need. Why? It's because we don't have the capacity to serve, but we want to serve everyone. Stagnant funding, increased expenses, growing aging population by 2020 or 2035. The 60-plus group will be the largest population in Sawyer County. Demand exceeds the capacity, prevalence of malnutrition and nutrition risk, and people living long and frailer in their homes. Frailer, is that a word? I don't know. In Sawyer County, we are seeing that over 50% of those receiving Meals on Wheels are not or unable to pay for their meals. Joey also sent over that the GWAR final 2025 budget has been submitted, but the contracts have not been received yet. And I forgot what the GWAR acronym stands for.
Okay.
But there's also 3 vacant positions on our Senior Resource Center board to be filled yet. So if you're interested,
Mhm.
but that's all she sent over.
Thank you. Anyone else? Is there any reports from conferences or meetings? Does anyone have future agenda items? Julia, do you? Mike, do you?
I don't think so. Nothing
Okay.
outside of it.
Let's call it a night. We're adjourned.
Thank you.